Not there yet. Okay, now you're there.
You guys are going to get to see how good I am on the camera. It's not so good. But we're going to have some fun today. We're going to get started with a live Q&A for Medicare questions in about 3 minutes. We're going to start promptly right at 11 o'clock. So hopefully people will join and ask me some questions. And I'll be using my phone to answer questions because the camera's turned away from me. So that's why you'll see me looking down. I don't know how. I'm just trying to figure out how I'm going to see questions. So just bear with me, guys.
If you can't see them, I can read them to you.
Okay. Hi, Mandy. Thank you for joining. I'm going to get you on camera one day. Mandy, if you have a question, go ahead and type it in the comments so that I can be prepared for questions. Give myself a little time to think about it. I'm hoping you guys will stump me with questions, but hopefully this will be a learning process for everybody of learning more about Medicare. Let you read me questions. Can you see them coming up? Because it's not working too well
yeah.
on mine.
Well, Mandy says hi with the exclamation point.
Looks like we have 4 people joined. Hopefully we'll have a few more. All right, I think it's 11 o'clock, so hopefully we'll get some questions.
Oh, Karen wants you to tell us about yourself.
Okay. So my name is Alyssa Sinagra. I work at Avery Hall. I've been here for about 15 years. I'd like to tell people I started when I was 12, so that, because I'm young, but it is what it is. I specialize in individual insurances, like for Medicare, people who are self-employed, long-term care insurance, life insurance, dental, vision. My focus is Medicare, but I try to help in all areas of insurance. I don't want to just help in one area. I live in Delmar with my family on the Delaware side. I have 2 boys, Luca and Eli. They're a mess. I am learning that my second child, who's only 16 months, is even more of a mess. He's given us a run for our money. And I put on Facebook last night, why hasn't anyone warned me about the second child? And then, of course, my aunt says, Alyssa, you're the second child. And so that was like perfect warning for me. I should have understood that by then. And my husband is also a second child. So we should have known we were going to have our hands full with that second child of ours. Do we have any questions yet?
Any questions yet?
No questions yet.
I can ask you a question.
Okay, go for it.
Okay, it's really basic.
Okay.
Who is eligible for Medicare?
Who is eligible for Medicare? So people who we'll start with people who are on disability. They have to be on disability for 2 years. So collecting Social Security disability income for 2 years before they become eligible for Medicare A and B. However, that is kind of a trick question, because if someone has been fighting to get Medicare disability or disability income through Social Security and they are rewarded backdated, then their Medicare starts retroactively, pretty much immediately. So that can, can mess up some people. But we here can usually help figure that out. People who are turning 65 become eligible for Medicare A and B, as long as they have at least 10 working quarters, I believe is the way it works. And then if you haven't, but your spouse has had 10 working quarters, then you become eligible for Medicare.
We got a question from Erin Middleton.
Great.
Who wants to know how soon before your 65th birthday should you be shopping for supplemental insurance?
So I suggest about 3 to 4 months. A lot of people will tell you a year, 6 months, things like that, but really start focusing on your transition from whatever insurance you have to Medicare about 3 to 4 months prior to your 65th birthday.
Karen wants to know what are some frequently asked questions about Medicare, or what are some myths that clients come in with?
Okay, so frequently asked questions. One big question is, do I have to enroll into Medicare? So if you have an ACA marketplace plan, so let's back up just a little bit. You don't necessarily have to enroll in Medicare, but you're penalized if you do not. So if you have an ACA marketplace plan, you should enroll into Medicare, because you're going to be penalized for not enrolling into Medicare, because ACA marketplace coverage is not considered creditable coverage through Medicare, and you're technically not eligible for that coverage. And then if you have an employer-sponsored coverage, as long as you or your spouse is an active employee with employer-sponsored coverage, then you do not necessarily have to enroll into Medicare. But I would always suggest that you reach out to your HR or whoever handles or administers your insurance through your employer to find that out.
Brandy wants to know who is eligible for Plan F under Medicare.
Okay, so this is a good one, because one thing I do love about my job is I feel like I learn something new every single day. And so Plan F was one of the most popular plans forever, because it covered everything at 100%. And so back in January of 2020, a new law came out that said that people who were eligible for Medicare A and B, it has to be both, prior to January 1st, 2020, were eligible for Plan F. And so if your Medicare A and B effective dates are prior to January 1st, 2020, then you can get Plan F. If you become eligible for Medicare B after January 1st, 2020, then you cannot get Plan F.
Okay, Mandy wants to know, if someone is enrolling in a Part D plan late in the year, do you suggest getting a plan with a high premium and low deductible and then changing plans for January 1st?
So that just really depends upon someone's prescriptions. And so a lot of times when I'm helping someone get coverage for October, November, or December, and they have a brand name drug that is over $400 or $500, a lot of times the plan that I am suggesting does have a high premium, because it eliminates the $445 Part D deductible for brand name drugs. And if you do the math, so a $445, let's say a $500 drug versus a $70 premium times 3, that's less than that $445 deductible. So a lot of times, in a lot of instances, it does make sense. But I would recommend that if you do buy that plan that has that high premium, is to make sure you reach out to Avery Hall to make sure that that plan is still the best plan for you for 2021, because it's more than likely that a plan with a high deductible on the Medicare Part D plan is better for you than the plan with no deductible for a full 12-month cycle.
Okay. Erin wants to know, if you had a HSA prior to Medicare enrollment, can you use those funds to pay supplemental insurance costs?
No, you cannot. The only 2 premiums that can be used with a health savings account, or that can be paid with a health savings account, is a long-term care insurance premium and a Medicare Part B premium. And so a lot of people who are on Medicare Part B are receiving Social Security income. So their Part B premium is coming out of their Social Security check monthly. And so what I typically suggest to people, of course, talk to your CPA because we're not tax professionals. But what I typically recommend to clients is that they reimburse themselves annually for that Part B premium so that they don't have to handle that every single month. And then long-term care insurance is a great way to use your health savings account funds. I have met with several clients who have a large amount of money in their health savings account and they just don't know what they're going to do with it. And so purchasing, insurance for your nursing home or, a long-term care stay for home health care even, that would be a great way to use those funds.
Paula would like to know, is there an open enrollment period for Medicare supplement like the RX plan has?
No, but Medicare Supplement uses the same term open enrollment. So open enrollment is different for Medicare supplements and Medicare Part D. So Medicare open enrollment is 6 months from your Part B effective date or your 65th birthday. And so that is different for every single person.
Mandy wants to know, does Medicare cover vision and dental coverage?
Medicare does not cover vision and dental. However, if you have a medical problem with your eyes, such as cataracts or macular degeneration, then Medicare will cover those services. Or say you have diabetes, and that's why you need to have an eye exam. That is a medical condition and would be covered under Medicare.
That's our last question.
That's our last
so
question.
Far.
We've gone almost 10 minutes.
They've been rapid fire.
They are rapid fire questions. I'm trying to think if I have a good question that people have asked a lot. So one question yesterday from a client was about her health savings account is if I start collecting Social Security, can I still, if I start collecting Social Security, can I still contribute to my health savings account? And this per se is more to people who are under 65 prior to Medicare. This person, I believe, was in her early 60s. But what we did learn, again, I learned something new every day, but what we learned was that so if you Google that question, it looks and appears that you can't contribute to your HSA if you're collecting Social Security. But technically what that is referring to is because at age 65, if you're collecting Social Security, you become entitled to Medicare. And so at age 65, if you're still contributing to your HSA, you've become entitled to Medicare. So that's when your HSA contributions would have to stop. Not at 62 when you start collecting Social Security. Again, we're not tax professionals, so always ask your CPA. Any other questions?
Not so far.
No, not yet. I'll give it a couple more seconds and then I'll try to see if I can think of any other as well. I love getting good questions that I have to research. Let's see. So I had another client that was moving from one state to another, and she was trying to figure out what that's going to do for her Medicare. And so for Medicare supplement plans, your Medicare supplement plan will go with you where you go, and regardless of which state you are in. However, once you're in the state and you're settled, you would obviously want to contact your Medicare supplement carrier and update your address, and that could change the premium. And so typically what we recommend is that if that premium changes significantly is to give us a call and let us research to see if that's still the best option for you. And then for the Medicare Part D plan, that actually creates a special enrollment period for you to be able to shop your Medicare Part D prescription plan to see if what you have is still best or if there is a better plan.
Mandy wants to know, is Medicare Part B the same as a Medicare supplement plan?
No. This is a great question because so many people will contact us and say, oh, you helped me with my Medicare, so I don't need Medicare anymore. You helped me get a Medicare supplement, so I don't need Medicare anymore. That's not true. Whenever you get a Medicare supplement, you must have Medicare A and B. They work together. That's original Medicare. A and B is primary insurance, and then your supplement plan is your secondary insurance. No more?
No more. Not yet. They're thinking.
They're thinking? I appreciate all the questions. Let's see if I can think of another one that might be a good learning one.
Oh, we got one.
Okay, let's go.
Brandy says, could you tell us the difference between a supplement plan and Medicare Advantage plan?
Sure. So a Medicare Advantage plan replaces original Medicare A and B. And so Medicare has created Medicare Advantage plans, which are Medicare Part C, and they have deductibles and co-payments, just like your original Medicare. They have to cover at least every service that original Medicare would cover. However, they can charge co-payments and deductibles for your services. And so Medicare Advantage plans are more like your insurance today that you either have through your employer or ACA. The premiums are less than a Medicare supplement plan, but your out-of-pocket expense can be more. The out-of-pocket range from $4,000 to $8,000 on Medicare Advantage plans. There's not a lot in our counties available to people. So the other thing with Medicare Advantage plans is that you have to adhere to a network. And normally those networks are really narrow. And so if you're getting a plan in Wacomico County, it's possible that that network is only in Wacomico County and will expand to other counties, but not significantly like Wacomico County's network. And then a Medicare supplement plan is secondary to your Medicare A and B. And so Medicare supplement plans work with Medicare. And so Medicare A and B will always pay first, and then whatever the deductibles and co-payments are, they would be billed to your Medicare supplement plan and paid accordingly depending upon which plan you have. Medicare supplement plans have higher premiums than Medicare Advantage plans, but your out-of-pocket expenses are much less than the Medicare Advantage plans. Hopefully that helped. I had thought about a question, but I think I have forgotten it. Yeah, I forgot it. We'll see if we'll got another one. Any other questions?
Not yet.
Not yet?
Not yet. I have a question.
Okay.
If somebody is turning 65 in the next year, what should they do to kind of like prepare for Medicare enrollment?
So you should contact one of our agents here at Avery Hall first. And I love talking to people in advance, like even a year in advance. I've talked to people 2 years in advance, but I love giving them the idea of what they're going to expect over the next year and like give them a timeline of when to contact us and how to get things done properly and in a timely manner, because if they can follow those steps, everything will run smoothly. And that's one of our goals here at Avery Hall, is to make transitions from whatever insurance you have to Medicare run very smoothly.
Okay, Mandy has a question.
Okay.
Can I change my Medicare supplement plan at any time?
You can change your Medicare supplement plan at any time. That's actually a myth. People think that they can only change their Medicare supplement during the Part D and Medicare Advantage open enrollment, but that's not true. You can change your Medicare supplement plan at any time. However, you do have to go through medical underwriting. And so medical underwriting is not a physical. Some people think that you have to get a physical during medical underwriting, but that's not the case with Medicare supplements. Medical underwriting would be an agent here at Avery Hall or another agent asking you a series of medical questions. Typically, these medical questions are what we call knockout questions. So if you answer yes to them, we know we can't submit an application. However, if you answer no to all of them, then we know we can submit the application. And so part of the medical underwriting is we ask those questions, we get a list of your medications, we submit it to the insurance carrier for them to medically underwrite. And they will either call you to verify your information to make sure that everything on there is correct if they have any other questions, or if they don't have any other questions, then they will either approve the application or deny it. So you can change your Medicare supplement at any time. This is another good segue to that question. Is I've had people that after an application has been submitted have been diagnosed with something or had some type of medical event. And this doesn't apply to like life insurance or like long-term care, things like that, but like medical supplements, like if you get diagnosed with something after you've submitted your application and signed it and they have already approved the application, then I mean, you can still tell them, but because that didn't happen at the time of signature, it happened after the time of signature, most carriers still allow that approval. So it's pretty interesting.
Okay, you've got 2 questions
Great.
here. The first one is from Erin. And she wants to know, are there a variety of carriers to shop this type of insurance coverage through?
Yes, so Medicare supplement insurance is very popular, and there are, I don't know how many carriers in Maryland and Delaware, but if I had to guess, there's probably 30 or 40 different carriers, and that's what Avery Hall does for people, is we shop it for people. The first thing we do is we eliminate any carriers that is not an A-rated carrier with AM Best, and we work with carriers that we know are reliable and that we've heard of. If there's a carrier that's coming in the market that we just haven't ever heard of, that's a carrier we might tell you about, but we're just not quite sure if that's the best fit for our clients.
Okay, Joanne wants to know, what is the best way to enroll in Medicare if you have worked beyond your 65th birthday and are delaying Social Security?
So the best way to enroll into Medicare is using paper applications. And you can either fax those applications to our local Social Security office or your local Social Security office, depending upon where you are. I have an email that I can send to people that gives them step-by-step instructions on how to fill out those forms. And then they can either fax it or drop it off to their local Social Security office. And that is the best way to enroll into Medicare. If you're turning 65, when I have talked to the local Social Security office, the best way to enroll is online, because it's an immediate, they receive it immediately. It's not something that they have to process because it's a piece of paper. It's an immediate enrollment into their system, and usually happens pretty quickly within 24 hours.
They're thinking again.
They're thinking again. So I have a good scenario, and I think this came up this week as well. So let's say someone is over 65, they have Medicare, they have a supplement plan, and they have a prescription plan, but their spouse just got offered this great job, and this employer is going to pay 100% of the spouse's insurance and the person who is on Medicare's insurance. And so the client would come to us and ask us, can I cancel Medicare? And you can. So as long as you have active employment between you or your spouse, and you have employer-sponsored coverage, it has to be employer-sponsored coverage, you can cancel your Medicare, your supplement, and prescription plan. And typically it would be you canceling just your Medicare Part B, but I have had instances where the person's job is also offering to fund a health savings account, so that's when you would have to also cancel your Part A. And again, this is something we can walk our clients through to make sure it gets done smoothly and correctly.
Marissa just joined.
Great. Hi, Marissa. I think Marissa has a question. Let me see if I can remember her question. I may have already answered her question. I can't remember it now that I have all these questions in my head. Has Marissa got a question yet?
She doesn't have one yet.
Well, Marissa, I know you got one, copy and paste. Raise your hand if you would like to do a Facebook Live here at Avery Hall and answer questions about what you specialize in.
Oh, Mandy has a question.
Okay, go, Mandy.
Can an employer pay for your Medicare supplement and Part D plan?
No. But I go back to the same thing of saying that we are not CPAs, so tell your boss to talk to their CPA. They cannot pay for it directly. It is not allowed. The carriers won't allow those checks to be received by an employer's bank account or check. However, if you're an owner of the business, I know that it can be done. I know that you can do it directly.
Marissa says hi first,
Hi,
but she does have a question. She says, if you can't enroll into a Medicare supplement plan and need secondary coverage, what should you do?
Okay. So we have people that get denied Medicare supplement insurance. And so let's say that so I'm going to try to start back in the beginning. So say you're turning 65, you're healthy, you don't want a Medicare supplement because you don't want that extra expense, and you just want to live on Medicare and pay the deductibles and pay the co-payments and the 20%. And so that's perfectly fine. Medicare supplements are an option. But then 3 years down the road, let's say your health is completely different. You know, our health can change any day. And so that's why we think, you know, buying that Medicare supplement when you're healthy provides peace of mind for when the event would come if something were to happen to you. And really, that's what insurance is for. If you think about your homeowners, your auto insurance, we want it when we're going to have a big event. We want to make sure that we're not going to have to sell our house to pay our bills. We're not going to have to take money out of our income stream during retirement to pay our bills. And so think of the Medicare supplement plan in the same way you would think of your home and auto. You want it there to cover like a big event. And so let's say someone comes back to me 3 years later, which has happened very often, and says, now I have X condition. And I know typically that X condition is an automatic decline. And so they're going to say, well, what do I do now? And so typically, let's use a heart condition as our example today. So most carriers, you have to have 2 years clear from the heart condition and not necessarily treatment free, but no changes in your treatment in those 2 years to be able to even qualify and be able to submit an application. And so that would be the first communication. The second communication I would make to a client that is denied is I would want to make sure that they understand all of their deductibles and copayments under original Medicare. Like, what is my worst case scenario? Because if you're hospitalized, it's only $1,485, $1,400, almost $1,500. But if you're hospitalized either 1 day or 60 days, you only have that $1,400 deductible. And in the grand scheme of things, if you have a hospitalization for 10 days, you know that bill is more than $1,400. And so that Part A deductible just needs to be explained and understood that would be all they would pay if they're hospitalized. However, that deductible does start over every 60 days. So that's why we do, you know, really preach the Medicare supplement plans in the beginning when you're healthy. The next thing is there are Medicare Advantage plans that are available to people, and you would just really want to make sure that they understand those copayments and deductibles versus what their copayments and deductibles would be if they just had original Medicare. So that would be my direction, is just I would just make sure they were more knowledgeable about what they had under original Medicare, and just really make them feel more comfortable about what they have under original Medicare, I think.
Brandy's got a question.
Great. Thank you, Brandy.
What options do you have for a supplement plan if you go on Medicare before age 65 due to disability, and what does it cover?
Okay, so Medicare supplement plans are available to people who are under the age of 65, and the state defines which plan someone under the age of 65 can get. In Maryland, the only Medicare supplement plan someone can get is Plan A, as an apple. Plan A only covers the basic benefits, and so it's only going to cover hospitalization days 61 through 150. It does not cover the Part A deductible, and it does not cover skilled nursing confinement copays. The other, for Part B, under Plan A, it covers just the 20%. And so a lot of people will purchase Plan A because the 20% is the most common claims that someone would get under Medicare, which is the outpatient claims. Any more questions?
Not yet.
Not yet?
Not yet.
Okay.
Oh, Paul has a question.
Great.
Are there programs to help seniors pay for their drug plans?
Yes. So that's a great question, Paula. Thank you for bringing that up. This is a conversation that we have with clients to make sure that they understand all the programs that are available to them. However, becoming eligible for Medicare, CMS and social services will send paperwork out to clients to make sure that they are aware of all the different types of programs that can help them financially. There are programs that help pay for the Medicare Part B premium. There are programs that help pay the deductibles and co-payments under Medicare. And then there's programs called Extra Help, which is like LIS, low income subsidy, that will help pay for your Medicare Part D plan and your co-payments under Medicare Part D, like your prescriptions. And so there's different levels of help, and so that's also based on income. But the way you would find out, if you wanted to find out, is you would contact your local social services department, not Social Security, but the local social services department, not the health department, not Social Security, social services. I think we did 30 minutes.
I think we did.
Do we have any other questions? If not, I'm going to go ahead and sign off. I'll give a couple more seconds to see if there's anybody else, but this was a lot of fun. I hope that it is helpful to people. I love being able to help educate and share my knowledge with people, so hopefully this will help somebody, and I really appreciate everyone joining today. And if you are coming and listening in on the recorded live video, hopefully if you have other questions, please just comment them and I'll be happy to answer them on our Avery Hall Facebook. Thank you, everybody.